It's my pleasure to get to welcome Julie Taylor this afternoon. Julie is currently the Mission Integration Manager of St Vincent's and Mater Health Sydney on the Darlinghurst campus, which, if you know Sydney, it's a major hospital, massive hospital in the city, serving many thousands of people every year. And prior to that, Julie was the coordinator here at Chevalier Institute, and I got to work with Julie in the early years of setting up the institute. And I said to her that there's these things on the paper I'm supposed to say, but I was going to say that I'm going to tell you all these other things. Anyway, it is a joy to be able to welcome Julie this afternoon. She's from New South Wales, has a background in Catholic education, in leadership and formation. And her professional experience ranges from that of a classroom teacher in primary school, through to being an advisor with the Disadvantaged Schools program, then to assistant principal, and then a long stint as a principal primary school in St Mark's, Drummoyne. And from there she came to Chevalier Institute and was the coordinator here for 8.5 years. She has qualifications in various areas, basically education, theology, and she also has a strong interest and many gifts in the area of holistic counselling and psychotherapy. She has, starting in the primary school and working in education, she went through and did a Masters in Adult Education as well as a Masters in Theological Studies. So she's a very well-formed person, and I'm sure you will find her session today very rich and very healing. So the topic is spirituality of the heart. Healing. Please welcome Julie.
Just before Julie starts, no, the temperature is. Are you warm, cool? Is it too cool, too hot? Just right.
And I forgot to say that if the clause paper is available at the back of the room now today.
It feels very, very interesting being up here. It's a bit cyberspace-ish, but good afternoon, everyone. Good to meet you. It's really good to be here and be back in familiar territory, and where my heart really is with spirituality of the heart. Making the shift, James could tell lots of stories, but I said be careful because I had the microphone after him, so it could be payback time. It's a very particular working relationship we had in the Chevalier Institute, because you travel together, you're visiting schools together, and there are moments where life is great, and there are other moments where we just, like a normal relationship really, things happen, but it's a really beautiful ministry that the MSCs have established, and I think it's really quite special. But it's also very heartening to know that in healthcare, also that these sorts of roles where the mission of perhaps a congregation is seen as a priority, and that as we might literally say that as religious not there in numbers, then lay people are having an opportunity to take up leadership roles. It's something we might feel as lay people that it's right we might have, or a gift we might like to express in our life in the church, but the positions haven't always been there. So now that is evolving in the life of the church, I think it's just a wonderful gift. I had to laugh when James was reading all my qualifications. It gets a bit overwhelming, but I thought I'm not doing any more. Except I did do this year a certificate in celebrancy. One of the weird things that has happened since I've been at St Vincent's is that we do lead a lot of rituals, and a lot of staff come to those rituals. They may not be church, they may not be Catholic, they may not be anything, but since I have been there, I have been asked to read scripture at a nurse's wedding and to give the reflection, like the homily, which was in Hyde Park in the city. Another nurse actually asked me to lead the whole ceremony for her wedding, and she would have an official celebrant there to do the official parts. So in light of that, I'm now a celebrant. So if anybody wants to get married, I can do that too. But it's interesting, isn't it, again, that as people move in and out of the life of the church, the roles, and they are seeking the spiritual no matter which way we go. They're looking for ritual, they're looking for meaningful ritual, they're looking to feel connected, and they're not always finding that in our church at the moment. So anyway, this area for me, spirituality of the heart and healing, is a very passionate area. It was one that I was very passionate about when working here, and in a way being attracted to work in a hospital was one of the reasons that I thought I wouldn't have left Chevalier Institute really. I love the work, but we do travel, 15 weeks a year, and my own health was struggling a little bit with that commitment. So in honouring my own healing, I needed to take care of me. So that's where I've landed, where I am. So I remember how to do it with this one. Okay. So look, the session I've planned this afternoon is really got two phases to it. One is around focusing on healing and curing and the differences around that and the connection, and then sort of drawing on some scriptural references, and then perhaps a third part, maybe I said two, but the third part really then is looking at it from the tradition and the work that the Institute had done before. So, you know, I've got some new thoughts and reflections since I've been working in a healing ministry particularly, but also to draw on the work that the Institute had brought to life while I was here. I must say, when I worked with Chevalier Institute for the 8.5 years, every time we ran programs or ran days or sessions or our retreat programs, yes, we had our content, we wouldn't, you know, but ultimately people started sharing their stories with you. They would tell you about their lives, and in fact, it was always about something painful that had happened to them. And when they had the chance to stop and reflect on it, really people would share their pain in their relationships with their kids. You know, someone having trouble with a drug-addicted child, or someone with a diagnosis that their life was challenged. So, you know, it really drew me particularly to think of this whole area and healing. So the way of the heart, and I have put some papers on your table, so most of the quotes that I'm using will be there. If you need any further referencing, I'm very happy to provide them. Some of these come from the work that James and I did already, you know, at the beginning of the life of the Institute, and some of them will be actually his words with some of my editing or input. So this one, I think it might have been one of yours, James. The way of the heart is a journey to wholeness. A spirituality of the heart invites us to embrace, integrate and share our woundedness on this healing journey. And it's through our woundedness and our pain and suffering with Jesus, the joy of transformation is offered to all humanity. And so healing is definitely the heart's journey. Really, really profound thing. Sorry, I'll get right with this in a minute. So the first four movements, have you covered some of the Castelli's movements of the heart? Okay, so Eugene Castelli, MSc, was Bishop of Brisbane, really was involved in the bringing to life of the movement of the devotion of the heart to a spirituality of the heart. And he talked about four movements of the heart. And the first one being that capacity that we have to go down into the depths of our own heart. And if we don't do that, we really are not being genuine, I suppose, on our spiritual path. And I would have to say, I think I did say that most people that we encountered in our work was really about responding to issues. But now, having worked for myself in Catholic healthcare at St Vincent's, I've been there now for 2 years, which I find amazing. I've been immersed in the life of an organisation whose primary responsibility is responding to physical and psychological ailments, reducing, if not eliminating, human suffering. And just chatting to Wendy, we were talking about two people she knows that are connected at St Vincent's, who literally are, you know, being part of research projects because of their perhaps diagnosis that's not quite determined at the moment. So what an amazing thing that we have people that are working continuously to improve people's lives and responding to needs that they have. So, you know, St Vincent's responds really as a hospital, as a healthcare facility, to the physical situations or psychological things that people are involved in, but in fact, bigger than that, the societal ones, the homeless, you know, the outreach that we have to other people. But in Catholic healthcare, the phrase, to bring the healing ministry of Jesus to all we serve, is the proclaimed mission. Now, I run orientation nearly every month, and people that are employed, 60 people start, either new grads or students, and I show other healthcare's mission statements, from other organisations. Ryde Hospital has better health, better community, tagline. And then I put up that phrase, say, to bring the healing ministry of Jesus to all. And I say, now, how many of you signed up for that? And most of them sit there and go, I didn't even know it was a Catholic hospital, I just wanted a job, or, so it's a really profound statement, and one I think I can unpack a little bit today. So that's part of the journey. And this mission at St Vincent's particularly was inspired by another congregation. So even though I feel like I might have jumped ships by working now for the Sisters of Charity, in a way where a charism is a window to the gospel. So I bring the gifts of who I am to their work, and if they're not expressing the spirituality of the heart by their healing ministry, I don't know what they're doing, but they certainly are. The healing ministry of Jesus expressed in the New Testament is reflected not only in the physical healing offered by Jesus, but I think what's significant for me is the profound impact of forgiveness as a healing element, reconciliation in the New Testament, that repairing of relationships, particularly due to isolation, religious, social, economic, political reasons, for all of those things to be overcome. So when I'm looking at healing, it's also about not physical healing, it's also about this repairing of relationships. So not only now do I witness the impact of a heart-lung transplant, bone marrow transplant, the remarkable work of an ED team being near King's Cross is unbelievable. They respond to drug, alcohol overdoses, accidents, stabbings, emergency surgical procedures. I now chat to the doctor who, saved the Navy guy's, life, who had his leg bitten off by a shark in the harbour. It just blows. Every day I go home and I think my world is just expanding, and blows me away that so many very talented and committed people are there to respond to these unbelievable situations people find themselves in. Sadly, the people that have been king hit have been at St Vincent's. We, not only as a community do the healthcare professionals deal with those deaths and traumas, we then have the media at the doorstep. So it's nothing for me to walk out of my office and see a Channel 9 or a Channel 10 camera out the front of the hospital. So you've got that sort of thing happening at the same time. I've even witnessed a car run off the road right at the front of the hospital, a guy fall out, and the emergency team were out there like my schoolyard CPE. You just sort of think, now what do I do? DRABC, help, danger, and they go, out of the way, Julie, yeah, right, good, back off. So, the person had a drug overdose, and I don't know how they drove there, but literally drove off the gutter and then out of the car. But there they were, straight out on the streets and responding. So, my world has been opened in a big way. The other area that I think has been very profound at St Vincent's is their work with HIV, HIV and AIDS patients. St Vincent's was the community that responded to that epidemic in the 80s. And I think that's just a very proud moment for the Sisters of Charity, who really took their, to bring the healing ministry of Jesus to the poor, the marginalised and the most vulnerable. That group were completely ostracised in so many different ways. And that group still works profoundly, and they would say HIV diagnosis is no longer a death sentence. They'd be looking at something like hepatitis C as being more challenging to deal with. The other side of this, in terms of healthcare and responding to current needs, our private hospital has opened a unit for young adult mental health sufferers. Again, at the forefront. So they're saying that group of young people, particularly young men, from 16 to 30, who perhaps have early diagnosis of a psychosis or some form of event that precipitates a mental health challenge. Again, saying early intervention is the key. There's probably only 2 in Australia units that like this, and already there's a waiting list. They didn't think they'd even fill the places, but it certainly is happening. Our organisation also responds in so many ways to different healthcare matters. Out at Auburn, we've got a connection with the campus at Auburn at St Joseph's, and they're about to open young care That's a facility for people that may have been in a car accident and at 18 or 20 now are quadriplegic. Mum and dad can't look after them. Most of those people end up in an aged care facility. So how at the forefront yet again. So this organisation is there looking and advocating and filling the gaps and responding. One of the things I really wanted to explore with you today is talking about healing versus curing. Particularly since I've been in the medical model would look for cures. You know, when we're looking at a spirituality, we're really talking about healing. That's something about a transformation. Curing could probably mean, if we looked at it in its purest sense, in eliminating all evidence of disease. You know, in our sense of healing, it means becoming whole. And I think this bigger meaning of wholing is filling out the missing pieces of a person's life. And this may even mean facing death in a more fully realised way. So you can be healed or on a healing journey as you are dying. And we have a palliative care service that also I can say, you know, not everyone, when they come to that moment of getting closer to death, is on that journey. But those that are on the journey of healing as they are dying are actually more at peace with that process, other than the people that are, you know, saying, no, there's going to be... I sadly met a mum from my previous school at the Margaret Hospital, which is part of ours, about 3 weeks ago, and she died the Tuesday after. I saw her on the Friday, and I could see she really was not well. She had breast cancer, been dealing with that for 4 years, and other people had said, it's it now, this is it. She was still talking about chemotherapy, the next range. I mean, she couldn't get up, she couldn't walk, she was... You know, and I thought some people just, you know, can't articulate that we're on that journey, but that's their journey and that's fine. So this is deeply embedded, I believe, in Jesus' desire for us that, you know, he's come to give life and so that we can have it to the full. I think it's really at the heart of what we do. Now, Christiane Northrup, a woman I have come to love on my own journey, she talks a lot about women's journey. She's got a great book on menopause for people in my age group, but also women's bodies, women's wisdom. And she talks very much about this difference between healing and curing, and it's a power that we all have. And curing, that something that doctors are called upon to do, usually consists of an external treatment, a medication or surgery, and often used to mask or eliminate symptoms. But this external treatment doesn't necessarily address the factors that lead to the condition in the first place. So healing goes deeper than curing and must also and always come from within. And I could say from personal experience that that's true for myself. In 2000 I had a life-threatening situation, an anaphylaxis, and I was in hospital, you know, ended up with an injection in my heart to stay alive, let out of the hospital the next day, and then I spent the next probably 18 months and probably still to this day healing from that experience and living with that constant way of being in my life. And the fact is that really Western medicine saved my life, but it did not heal me, And if I wasn't seeking support, spiritual support, psychological support, alternative therapies for that matter, I would not have felt as whole after that experience as I would have as I just left and saw the immunologist, who also was a very important piece of the puzzle. So all healing is, I believe, is a spiritual experience, whether people put that language on it or not. So definitely healing is, I just read that for you. So healing's definitely an inside job. You've only got to think of what happens when you cut yourself. Put a Band-Aid on, and where does the healing come from? You know, inside. It's your body repairing, renewing. It's just, if we can't get amazed every time, that something repairs. I see people now, you may have had an amputation. My father had one, and the next minute they're up and walking. There was some program on the television the other night where a woman had creatively made an artificial leg out of Lego for herself. And it was amazing. She got up, used her artificial leg, and I thought, just even when bad things happen, people look for the good and to find a way forward. A bit of a person that's become close to my heart was when I was working at the Institute is a woman, Rachel Naomi Remen, who is a doctor. and she's a medical doctor in America, and she has written a couple of books. Kitchen Table, is that her, James? Kitchen Table
Yes.
Wisdom? Yeah. So lots of stories around healing, but she works specifically with doctors to say that they need to raise their awareness of not only looking at this clinical side of treating people, but treating the whole person. She herself has lived with chronic Crohn's disease her whole life. So she herself as a doctor has had a condition that is not curable. She will always live with it. And this is a poem she wrote. O body, for 35 years, 1,573 experts with 14,372 combined years of training have failed to cure your wounds. Deep inside, I am whole. So despite all of that, despite all her interventions, and in attempts to live with her condition, the journey to wholeness is a different journey. And she has found that way. And that's the work she does now, to bring doctors along with her and clinical practitioners to focus on this wholing part of it rather than the healing part of it. I must say, you wonder these days what's happened with that sense of having a convalescent home. You know, I thought, you used to be able to sit in the sun and be in a wheelchair and have your blankie around your legs and get well. You know, now it's like you've got to get up and get back to work, you've got to take a painkiller to keep this going, and Codral to do that. And what's this thing? Soldier on with Codral. You know, we just got to soldier on. We don't allow ourselves time to deal with our unwellness, even if it is physically expressed. The other quote or poem from her came from the centre that she runs. So it's about her institute that she's established, and somebody talking about the nature of healing. In a place of stillness, the one who thinks hears the whisper of the heart. In a place of trust, the one who cures heals. In a place of acceptance, a stone can explode into a butterfly. So she has set up an institute where medical practitioners are finding this place of stillness to bring this deeper transformation. They may not have the church or religious language around it, but if you added, one who thinks and hears the whispers of the heart, that links to Kaskelly's, moving, getting in touch with our own inner being for us to move forward. So disease in so many ways is very much about a spiritual path. Much illness is often caused by, or she believes, a loss of connection with our soul. That's where she starts, a lack of meaning in people's lives. And I think now being connected with the very acute end of healthcare, exposed to so much around that I think it's quite true that we can spend so much time coming in for diagnosis, for treatment, for whatever, but if we don't offer something that companions that journey, we're not really doing people any favours. We're very blessed in a Catholic hospital because you not only have your psychologists, your counsellors, your social workers, but you have a pastoral care team. And the pastoral care team, do companion people on their spiritual side of their journey of healing. Very hard for some people that aren't believers, if you like, for want of a better word, to understand that in a healthcare system. But I really say to them, it's equally as important if how everyone gets out of. Doctors still have very high status, I must say. Everyone stops when the doctors come. But I said, if there's an interaction with a pastoral care person and a patient, you do not interrupt. It could be prayer time, they could be praying, they could be, some very personal thing being discussed, they could be receiving communion. So to get the clinicians out of the way at that time is not easy. But that's what we're on about. One of the things that I wanted to now move to reflect on a couple of scripture passages, and one I've invited Phil to share as well, his reflections. But the Good Samaritan is the story. It's like the quintessential healthcare story when Jesus responds to the question of who is my neighbour. It's like the text. And I've given you the article by him. Yes, Jerry Arbuckle. And Jerry has put a great article together, and I think that's where I'm drawn a lot of this from. I think I alluded to the fact that, you know, Jesus' role in the stories that he told with the power of forgiveness was equally as important as the curing in terms of the miracles. You know, so many, the leper, the blind, the infirmed, their healing was about them being re-engaged in the community. So it was like the lepers being able to rejoin the community because they'd been ostracised. So the healing was from isolation to inclusion, from exclusion to embrace, from integration to wholeness, you know, a complete transformative journey. And I think he quotes, he says, even Princess Diana once said that nothing so fragments the human spirit than being in isolation. So that sense of us being connected to our communities is really significant. It was also the opinion of Pope John Paul II that the parable best articulated the heart of the healthcare mission, and the ministry of Jesus was that of the Good Samaritan. And he invites us to fix our gaze on the Samaritan. And so it's a text that we unpack quite a lot at our place. It's a text that we refer to and try to give people an understanding of the dynamic of this experience, which might seem, you know, one good person, a lot of people walking past, but another person picking up and helping. But actually there's a much deeper level. The parable, Jerry Wright says, remains as the standard which imposes universal love towards the needy, wherever they may be. And I just wanted to share with you, I'll come back to it, sorry, I mustn't have it there. I want to share with you later the Sisters of Charity definition on the poor and marginalised, because we often have this debate at work as should we be in, you know, private healthcare when people have a lot of money, or should we be in public healthcare? As a Catholic organisation, it's like the same debate between private Catholic schools and systemic Catholic schools, or should we, you know, where should we be putting our energy? But he believes, Jerry Arbuckle believes, this text really says we've got to be at the forefront with the poor and the needy. So the Good Samaritan is a theme of healing of the heart is really important. In the parable, the caregiver seeks to heal the body of the victim, but above all, he seeks to respond to the sufferer's pain of inner rejection, and that's a critical thing. In Jerry's article, he talks of 6 levels of violence or violation in a way, and the verbal one is really connected with the Torah scholar and the religious lawyer who challenges Jesus verbally and aggressively publicly challenging him. The physical violence he talks about is the assault of the bandits on the innocent man. The ritual violence comes from, you know, when the victim is covered in blood and they become impure and unclean. And socially, one of the things that is the most profound in this story is someone being stripped naked. You know, that sort of shame and humiliation. So, you know, if you can imagine if you were in that situation, you were injured, if you were stripped naked and left bare, you know, that sort of sense of recoiling and not being able to get up and even help yourself would be just nearly impossible. The racial violence he connects to being the 2 pillars of the biblical Jewish culture, being the priest and the Levite. You know, their tradition required compassion to the poor and the marginalised, but because of their rituals, they walked past. And then his other one was, I didn't understand for myself that, you know, Jerry's gone into the research of it, would be, you know, traders in oil and wine at that time, and looking at the dynamic that socially would have been happening around that time, and just said that occupationally there would have been incredible prejudice between the guy carrying the goods and the innkeeper. So a lot of issues around this story just has so many layers that is very helpful to help respond in terms of healing. Essentially then, the Samaritan is portrayed as someone who is compassionate, that he is courageous, he risks his own life, gets off his mount, you know, which in a sense, Jerry would say, made him more vulnerable in his helping of someone, because if you're off your mount, you can't get away from other, you know, the fear of future attacks. So the fact that he actually got off his mount to help this poor person was actually saying he was prepared to make himself vulnerable as well. That he took ritual and social risk at some cost. By bandaging the wounds and pouring wine and oil on them himself, he became unclean. So he became ritually impure. So another dynamic. So we ask our staff, are you prepared to do this? Are you prepared to risk You know, are you prepared to get off your mount and I'm challenged nearly daily in the community that I'm in to do, you know, where do I get off, you know, my horse and take the risk? And it could be that person that's yelling in emergency, the person that's coming off drugs that freaks me right out, and they're in the back lane and they're wanting help, and, you know, what do we do? You know, I've been in the middle of a domestic dispute between a couple where one woman was wheeling her partner out of the hospital, and they were going for a smoking outside the hospital. They were going for a ciggy, and there were cobblestones across where the pedestrian crossing was, and accidentally she tipped him out. Now, not only did this man be tipped out, he was an amputee, and he had been hit and had the other leg in plaster. So he's on the middle of the walkway. She's on the other side of the road going, I can't effing do this anymore. And he's going, come back, love. So I had a friend with me, so I said, you go with him, I'll go with her. This went on for over 20 minutes. And do you know how many people just walked past us? Couldn't believe it. You know, this was a really big guy, and I'm trying to get him back into the wheelchair. We've got all these work, health, place and safety rules, not supposed to lift, not supposed to do this, anything over 2 kilos, you know. So you're going, okay, we've just got to sit here. He's trying to get up. They're just having this hurling, swearing match at one another. So finally get security. It still took about 15 minutes to get someone from the ward down to take him back. She ran off. She said, I can't do this anymore. She's gone. So she's taken off. And I thought, you know, I was overwhelmed. By the next day I went home, I think I was shaking. And the next day I thought, I'm just going to go see if I can find that guy. And you know what? There they were in the room, sitting together, having a cup of tea. And I was like, my heart was thumping. But every day, it never ceases to amaze me what we come across. And the Samaritan's capacity to go to the margins, that's what I face. And I think, even though this parable speaks very blindly or bluntly to me, I should say, at St. Vincent's, I think the question we have to ask one another is, where is it where we are? Where is it where you work? Who are the vulnerable? Who are the marginalised? Who is in need? Who is laying bare? Who is wounded? The gospel imperative is that we somehow respond to that. And even though we're in a healthcare environment, it's easy to say, oh yes, we are responding to that because we can medicate, we can do this, we can do that. But the challenge I'm finding is to say we need to go deeper than that or higher than that to make sure that we are responding. And finally, the gift of hospitality. The Samaritan offers hospitality by taking the injured man to the inn to be looked after and cared for. We take hospitality very seriously, and the MSCs take hospitality very seriously in the sense that it is what you do. You connect, you offer hospitality, you come to table, you break bread without being at Eucharist, you're living in Eucharist, you're giving life to it in that way. So I think it's very significant, this parable, for us, not just in healthcare, but in any ministry that we're working in. I don't want to go into this part too much, but Jerry also talks about 6 truths. So I'm trying to pull out a couple of things I think when you read the article might help you. But the 2 that connect to what we're talking about today, one is that the 6 truths that come from the article. The 2 I want to refer to are the holistic healing and the prophetic role. Pope John Paul II wrote that the parable not only spurs one to help the sick, but also to do all one can to integrate them into society. For Christ, in fact, healing is also this reintegration. And I must say, St. Vincent's does a lot to do that, to reintegrate people. We deal with a lot of homeless people in our community, and there's a policy not to discharge from hospital to homelessness. Huge ask, you know, it's a huge challenge for our social workers, a huge challenge for our hospital. It's terrible, but they talk about frequent flyers at the hospital. A frequent flyer is someone who constantly presents, and they present through emergency. The people that are frequent flyers, sadly, are our homeless people. And they will present with an Aboriginal community too, present, and sometimes they don't wait. They get what they call triage, so they get seen immediately, assessed, and if they have to wait for too long, they're out the door. So 1, they're out the door, or 2, if they're so sick, they may be admitted. But if they're discharged from the hospital and they get a packet of pills to take, or if they get medication to take, the chances of them continuing that treatment are next to nil. So 3 days later, who represents? So we've got this cycle happening of caring for people in a way that's just band-aiding. Because there's the deeper social thing, which is what Scripture's saying, the deeper social issue is not being dealt with. So we have extended the Band-Aid, which is a fantastic thing, and doesn't happen in any other hospital, but St Vincent's have opened what they're calling Teeny House, named after Sister Teeny, who fed men and women, particularly men, that were unemployed in the years of the Depression. So we've got a gorgeous picture of her in the back streets of Paddington with a table and covered in a beautiful tablecloth, serving scones and cups of tea to the men dressed in suits who are unemployed, coming into the city, and perhaps their families may or may not have known they were working or not working. So they've set up Teeny House. Teeny House is less acute, so not as intense medical intervention, home for the homeless, so that they can stay there and finish their medication regime. Sadly, some of them may go back to living on the streets. Sometimes they're able to find them a home, but at least they're going to be well for a whole lot longer before they come back. So this whole sense of being prophetic as well as being concerned about the holistic side of it and being an advocate for them is really, really important. Prophetic role, I think we all have that in terms of responding to the poor and to the marginalised. That's come through this parable. This is the Sisters of Charity definition. We understand the word poor to encompass people with special needs, those lacking finance, skill, status in order to meet their needs, which may be economic, material, psychological, sociological, cultural, or physiological, spiritual or any other impoverishing factor. We have an ongoing debate as to who are we serving when we're saying the poor and the needy. So this definition for us actually says a woman who's just had her ovaries removed, who may no longer have or not be able to have children, or a man who's in that position who may have had some cancer that would prevent him from fathering. So it gives us a conversation to say to people, we are living the mission because our impoverishment is coming at a range of levels. I mean, I walked up to one of the wards in the private hospital the other day because a friend's mum's in there, and the ward had the average age would have been 83. And I thought, ageing people, our ageing population, also what sort of, poverty of spirit do they experience as their capacity diminishes? Not just because of the health things that are happening, but their recuperation, their sense of life and purpose. And this friend's mum was saying, I just don't think I've got the energy to go through this. She had bowel cancer, and first time to have had cancer and have, cut from here to here, and she just said, I don't know if I'm going to, be able to get through this. So again, this definition really extends our prophetic role to say, well, we can be a voice and be aware, be more aware of those that are in need. So that's as much as I wanted to share just on the Good Samaritan, because it's a story we know so well, but I think Jerry's take on it gave me some new insights. I really wanted to offer you the article and to take away, and for those of you that work in schools, I mean, I think it's got an implication very much for the students that we deal with, and even our staff. We can't underestimate the vulnerability that they are experiencing. So I'm just going to ask Phil then to talk about two other pieces of scripture, or one piece of continuing the story, one piece of scripture, because he shared this with me, and I think because he shared it with me, I feel he needs to share it with you.
Thanks, Julie. Just a little interlude. The scripture passage, it's one of my favourites. It's Mark 5:21-43. And it's the woman with the hemorrhage, if you know the story. I'm not going to read it, but just to recall, Jesus is going along, and a Roman officer comes to him and says, my daughter is sick, could you come and heal her? And this is just on Julie's language. It's a good story around healing and curing, so just keep those paradigms in mind. As Jesus is on the way to this girl, the adult woman who had been hemorrhaging for 12 years constantly comes out of the crowd, walks up behind him, touches him. Jesus turns around and says, "Who touched me?" And the disciples don't be stupid. There's a crowd. "What do you mean who touched? There's people bumping against you all the time. What do you mean who touched us?" And he says, and the woman sort of, "It was me." And Jesus, there's an encounter. Jesus touches her, and she goes away healed. Family come to him from the girl and says, "It's too late. She's already died. Don't come." And Jesus says, "She's not dead. She's only sleeping." Goes into the house, takes Peter, James and John with him into the room, says to her, "Girl, stand up." And the girl stands up and he says, "Wait on her. Give her something to eat." You can read that story as if you imagine the video clip and the little episode in the life of Jesus and just see what happened and interpret it in a very literal sort of a way. So he heals this woman who's been bleeding for 12 years and this little girl who's died he sort of brings back to life again. I think there's a much richer, deeper level to that story than that, and just a couple of things that perhaps might help you to get into it. What the story demonstrates is what the life in the kingdom of God ought to be like for women, and especially if you think of this culture, of anybody who's marginalised in that sense. She stands for the marginalised. What you've got within the story, you've got, it's a class, I don't know what it's called in literature, but it's the story within the story. So you've got the 12-year-old, I didn't say earlier, but the girl who's the Roman official's daughter, she's 12 years old. The woman's been bleeding for 12 years. Clearly, Mark, the writer of the text, wanted to draw, there's something happening between those two stories, the young girl and the older woman. And so it invites us then to say, well, what is that? What is that connection? The adult woman, she's sick with, in this culture, the most polluting sign of what it was to be a female adult, to be bleeding. And in her case, it's exaggerated. She's been bleeding constantly for 12 years. She spent, the story tells us, Mark tells us, she spent all she has on doctors and the medical profession, and still she's worse, she's no better. So every penny she spent, she's bleeding for 12 years. To be bleeding in that culture, Julie's mentioned with the Good Samaritan, blood's a sign of impurity. So because she's bleeding, she's not allowed to have, she's isolated from community. She's not allowed to have any contact with anybody else. She's not allowed to cook in the kitchen. She's not allowed to have any social discourse. She has to be isolated from everybody. It's an exaggeration of what happened for women every month with their period, who would have to be isolated for the week, 10 days, whatever it was, during that time. And at the end of it, they'd go through a ritual purification process to come back into the community. This woman, 12 years constantly, so isolated. What happens? She comes out of the crowd and touches Jesus. She's impure. What's she done to Jesus? She's immediately made him impure. And anybody in the crowd that she's brushed up against, she's not allowed to be there, see? And the story tells us she comes up behind Jesus. One interpretation, because Jesus isn't allowed to see her. She's not allowed to be seen in public with that affliction. She touches him and she invites him. This is a healing for Jesus as much as anybody. She invites Jesus, here I am. You're a male, you stand for all that is male in this culture in relation to me. She invites Jesus to look at her, to see her face to face. Claude was talking yesterday about what happens when you come eye to eye with somebody. Here's a real person who's marginalised. The story says, so in doing that, she breaks all the taboos of the culture. It's an extraordinarily courageous act on her part, and in the process, she's healed, not just, or perhaps not even cured. But there's a healing that takes place, and maybe there's a curing as well. The story tells us Jesus felt power go out of him. And the question could be, what power went out of him? We generally interpret, the power of healing went out because he felt this energy flow out of him into the woman. this other interpretation says perhaps the power that went out of him was the power that men had over women within that culture. All of a sudden, that power that had marginalised women was gone. He was face to face, and he was able to suddenly meet her. And the story says that often the translation is she fell at his feet. The same Greek word apparently, and I don't know Greek, but the same Greek word can also mean she embraced him. So Jesus and her embraced in that act. So it's an act of healing. It's an act of Jesus being healed of that power. He sort of suddenly can include another whole group of people that as a male in that culture he wouldn't have been able to do before. He is, as a result of that encounter with the woman, he's then able to go to the girl who's sick or perhaps even died. What do we know about a 12-year-old girl? The beginning of adulthood. She's at the beginning of her menstrual cycle. She's of, in that culture, she is of marriageable age. Just as the 12-year-old boy is bar mitzvah, fully adult male within the religious tradition, this girl is of marriageable age at 12 years old. She's beginning that period of isolation, of being marginalised as a woman because she's going to bleed as a natural part of her being a woman. Jesus, having been healed of that with the woman, is able to go to this young girl, take her by the hand and say, get up, you're not to be isolated anymore. Give her something to eat. He brings her into the diaconia. He brings her into the family, into the table fellowship, which is, as we know, is the most inclusive act that of Jesus' ministry, where nobody's excluded, everybody's invited to table. So that's just that little take on that story. So was the woman, the healing that takes place, the woman is healed because she's no longer locked into being marginalised and isolated. Jesus is healed because he's able to look at, in a bigger vision, for not just this woman, but this girl, and all women now are to be included. And the Christian community, not sure how well we've done it, but that's for us as well, to invite all people. Nobody's to be excluded for any reason, certainly not because of one of the defining signs of womanhood.
Phil, I've become now known if they say, Julie, you're going to do a scripture reflection, they say, not the woman with the hemorrhage. I just wanted to show you that picture enlarged. I've looked at other artwork and her face is revealed, but this piece of art, she's completely covered, which fits with perhaps the interpretation Phil was just sharing with us. And she's at ground level, not worthy to stand, to approach, even from behind, which goes with the sense of being with all those people who would have also seen her and say she should not have been there. Her reaching out says something to me. That hand says something to me, that she's taking an active stance in her journey, which is also part of the healing story, that she's not being passive, she's not waiting. She's been actively pursuing, through the medicos, through the treatment, whatever was available of the day. And now she's heard that Jesus has this gift that she could bring, something different to her life. So look what she's risked to do it. She's stepped out in a community where she's not welcome. She's lowered herself to the ground. She's approached him from behind. And I just think it's such a powerful story for us all.
And Julie, it's interesting, isn't it, that she's surrounded by pure people in white clothes.
Yeah, and look what she's, interesting. Yes, so she would have stood out even more, Alison, you're right, had she stood. It sort of breaks my heart in a way when I see it. But these, what I suppose the invitation is, what are for us, or the challenge to, who are the people that we are not noticing? Who is coming up behind us? Who's, on the ground that we don't see, that needs us, that needs our support? And we need to have those eyes, the eyes of the heart at the back. If you had an eye at the back of your heart, Who is it that we're not seeing? And it's one thing for us to see the identified groups. We're very good at St Vincent's of having identified groups, and you would too, schools, Indigenous and Torres Strait Islander, communities. We have our homeless health group and asylum seekers. We have 3 priority group areas. But, I'd add drug addicted, I'd add, there's just, there's so many. Mental health, whatever, there'd just be whatever. So it's in wherever you're working, whatever your ministry is, I think the challenge is to sometimes look behind and see who needs us and who we can support or who's reaching out. This wasn't a very good image of Jairus' daughter, but it was the best one, and it's very blurry. But a lot of, when you go to look for artwork that reflects scripture, it's very literal or very classical in its design. But I think for me, it's not, just again the woman's low, the girl's low. I know she's not well, or maybe she is well. I think she's dead. And Jesus lowers himself to be next to her. So I also don't underestimate what visual images can do in our work to bring people in on the story. It's very, very, very helpful. So I wanted to offer you an opportunity before I go on, and you can take any one of these questions that maybe speaks to you in some way. Healing ministry is a language we use in healthcare. Might not be where you are, but if you look at healing ministry in that reconciling sense, because if you're looking at the ministry you're involved in, when have you felt you've been affected or touched by a healing encounter? Maybe when you've reached out, or when you did get a surprise that someone had reached out to you. And maybe you found out about it after the event. I must say that's happened in the life of the work at Chevalier Institute. The number of people that may have said to me, you have no idea what happened at that retreat program you offered. They might tell you 3 years later or 2 years later. So have there been any moments like that where, or it could be a student or it could be a parishioner, someone who you've only because they told you in a way that you have made a difference to them? And if you have any sense of who's reaching out to you, or are you like the woman and who are you reaching out to? So I just want to offer you some personal time for a little while, and then an opportunity to share. So even if you want to jot down some points, just really to focus on your sense of those reflections on Scripture, and particularly, these questions. So I'll just offer you, a few minutes to do that for yourself. Even if you want to stand up and have a stretch, that's fine, or go for a little wander, but and then an opportunity to share. So any reflections or comments you'd like to share with one another? I feel a bit strange being up here for this conversation, but if there's things you want to, any comments you'd like to make?
Or the two examples that we have about the woman reaching out and Jesus lowering his status, it is a dialogue thing. And it has to come from the patient, one needing, and also from the one who is trying to give the love. And only that happens, and we know that the center is always there. They meet at the center, which is the heart. If it comes with love, even the smallest of the child will always get it. In the schools, with a smile, simple smile that we give. And we all know from our own experiences that the teacher is very serious, comes into classroom, you already build your own defense. You will imagine all sorts of things. Yeah. And if he comes with she comes with a smiling face, you know that that is open in the world for you to be open and it's given you a safe place. And as I see the scripture that you have there is the word that binds people together. And from my own experience, like in PNG, people in parishes that the messages were working, said, we always want the message to come back. And I was wondering as a young man trying, why is it that people want the message? Because we have not really built big schools and big hospitals and all this. And then I discovered because people from Europeans, Australians and Europeans, and they came in and they ate what we normally eat. They stayed with the people, physical engagement. That's the, I think, and that's what the spirituality of the artist. And even some tried some bit of language. And once you speak, and they said because they came and they stayed with us. And they lived with us and they suffered with us and they lived their place and their comfort zones there in Australia. They have good houses and families, and they came in just being with us. That's why we still want them.
It's lovely examples of a contemporary expression of this, and just saying that relationship is so important. There is a reaching out and a response. And if there's an openness, and I think that's the thing of the smile being the openness, and the capacity you just acknowledged of being able to be one with, to have that empathy or sit at table with and live with the community. Yeah. Thank you. Any other reflections?
We just talked about the giving, receiving side of it. Sometimes the receiving is harder than giving. Really. Sort of some experiences around that.
I
suppose back to that story, the woman with the hemorrhage story. Like the beauty of Jesus in that story was that he was able to receive. He was able to receive the challenge that the woman offered him. He could have ignored, but he was open to move and change. And sometimes there's a softness of heart in that that's not always easy.
Further to that, it was just in my mind then when you were speaking, Jesus more often than not comes across as the giver, providing the source in many times. And if you are trying to put yourself in a position of receiving, he doesn't model that particularly a lot. And yet, if you look for the times when he was vulnerable and terribly, terribly in need, it just popped into my mind when you were speaking then, Phil. I thought, really, that's what I should be holding on to, the times when he modelled his vulnerability, meaning very, the very human side of it, but, it's just a good thing to hold on to, because it is very, very difficult at times to be the taker or the needy one.
Yeah, and to receive help when you need it.
It's when you most need them, they need to sleep on it.
Says a lot, doesn't it?
That experience.
I was really struck, I suppose, by the distinction between curing and healing. And what I kind of heard you saying, Julie, and this really resonates with me, is that a lot of healing is a lot to do with our beliefs about sickness and suffering and struggle and failure, and it's a lot to do with what results from those beliefs, whether they're personal beliefs or cultural beliefs, the social isolation, the exclusion, the self-judgment that goes on. So, like me being sick with something, a disease, X, whatever. Through history, through the centuries, in almost every culture, that has this impact. All these beliefs follow from that, or there's beliefs about that, and about what that means about me in relation to the community, or what that means about me in relation to God, and is God punishing me, and have I, all of that stuff, which, just as I listen to you talk about healing as a more whole thing, and as really, first, one of the things is that all healing is spiritual, and that really resonated deeply with me in that context of holding and inclusion and advocacy. But it's really, Rachel Remen's thing, it's all about much illness resulting in disconnection, some kind of disconnection, and it's just, almost every sickness exists in a cultural context, doesn't it? Well, not almost, everything, or if it's not a sickness, something that happens to us, some other kind of brokenness in life, or financial failure or whatever. And I suspect that's related to what we find hard about the receiving, at some level anyway. We don't have time to go into that, but it all, and I suppose I'm seeing connected with other sessions we've had, but the first morning was about culture, and all of this exists in a cultural context, and a culture is this set of beliefs and values about things, which results in what you were saying about
Yeah, agree with you. So I'm just thinking a few things have come. When you're saying the belief system you have around it, like I don't know about you, but my dad when he was sick was saying, what did he do to deserve this? And it really is about our beliefs and what God would allow this tragedy to happen. So do we believe? What sort of belief? What image of God do we have? So you're right about it being connected to our faith, our belief system, our own family of origin, what was culturally expressed in that. If I look at people around the campus and think, my God, all these things, God's not out to get people. This is part of the human condition. Actually, being unwell is part of being human. And even in the scripture, we've got the couple that had the blind man say, what did their parents do for him to be blind? So culturally, again, so there's this sense of blame that, you have a child that has a deformity because you've done something wrong. Or we ostracised them and they didn't live with us. See, that's what happened years ago. Our friends of mine in Ireland had a child with Down syndrome. He's now in his 60s. But most of the community at that time would have sent them away. They weren't allowed to, they weren't kept at home. And they weren't taken out, too embarrassed to take out a family member who looked different. So we have the culture has shifted, but it's that sort of imperative, I think, to respond somehow. And I, it's about reflecting. And sometimes it's not until you've had something happen to yourself that you actually ask the bigger questions around this. We had Richard Leonard, the Jesuit, come and speak at a conference a few weeks ago, and his sister was in a tragic accident where she became a quadriplegic, and he's written a book about the journey, and she's written a book about her journey, and he told us that for 2 years she pleaded with him and the mum to kill her, to put her out of her misery, and for 2 years he said, do you know what, even as a priest I thought about it. And she was a nurse, she was working in an Aboriginal community, the whole thing, so quite a tragic story. But he said you wouldn't have believed the number of cards that they, that came and said, this is God, God only sends things to you as much as you can do, that gives you as many crosses as you can bear, and all these patronising things that people say around why this happened. He said very few said we're with you in it. More was about put up with it. It's a cross you're going to. And I think in addition to that, his dad had died when he was very young, maybe 3. So his mum saying, what did I do to say that my husband had died and now my daughter's a quadriplegic. She's in her 80s. I think they live in, is it Toowoomba still? They live in Toowoomba, and she turns her every couple of hours, even during the night, 1 o'clock, 3 o'clock, 5 o'clock. So she's still nursing her daughter.
I must have known you were going to mention it. Just on the table there, I've left books in relation to
have you?
his book, Where the Hell is God, that talks about that or something.
I told him that years ago at St Mark's at Drummoyne, in a 3-year period, we had 2 students diagnosed with a brain tumour and a teacher. And so in that 4-year period, the 3 of them died. And his article that somehow managed to be, before he'd written his book, was a loving God that allowed a tragedy to happen. So it was an article in the newspaper, and I told him, I said, you have no idea how that helped our community deal with this, because we were saying, how the why and the what, and you forget you can't ask those questions, when it's why or why me. On this journey, there's no answer. It is.
Bad things happen to good people.
Yes, yeah. So any other remaining thoughts we would like to share? So thank you for having a conversation with one another, because these are often inputty type things, but it's good to have a chance to integrate it a little bit, just mindful of time. I've prepared things around the spirituality of the heart, which I think I'd be happy to give in an article if that's okay, or give you the document so you can read it, because we did a lot of work. If I can, bear with me, I'll flick through a couple of things and just see if I can find some. Look out, the things that we developed with the Institute were really around the transformative journey and looking at aspects of the spirituality in this movement from woundedness to wholeness. So I'm going to jump across a few things. I want to move over all of those. This was our way of defining spirituality of the heart, but essentially talking about Jesus' woundedness as being a source of new life for all. It's foundational to our spirituality. And I think the wound, which I'll quickly show you, sort of, this is another one of Rachel's saying that she talks about wounding and healing are not opposites. They're part of the same things. You know, and I think it was what you were saying, you know, about the MSC's meeting and coming where people are at. But if we can't, we can be compassionate with the wounds of others because of our own limitations. You know, if we're not compassionate with ourselves, then we can't be compassionate with someone else. It's our loneliness that helps us to find other people, or even to know that they are alone or with an illness. So Rachel says that she's perfectly well-served people with parts of herself that she used to be ashamed of. So she's identified in others what's in herself. And it's because we can identify with the woman crawling on the floor, because she's reaching out. We've all had those experiences, maybe not to the same depth of experience, but we've had them. We've had times of need, we've had times of vulnerability. And she's saying in this journey we can connect in. Wendy Wright, who's written about, is that at the back too? There's a Wendy Wright book. She comes from the Salesian tradition of the heart spirituality, but it says that the tradition holds this stunning insight that the divine is revealed in the specific embodied persons and events of our lives. So therefore it's revealed in this beautiful spiritual journey. So I'm going to jump over a couple just so I can get to a couple of other thoughts. And then I just wanted to finish with a bit of a prayer. This Paula Darcy, it's a little bit like Richard Leonard. She had a story of a tragedy in a family and basically said that God comes disguised to use your life. So everything is about your relationship with God and God with you. And Richard Leonard said, I can't imagine any other God but a God who'd be crying with us, a God who would be feeling our pain, a God who would be wondering the same question, would it be better to be dead or would it be better to stay alive? You can't imagine anything else. Profoundly, I had an experience too. I honestly go home in awe of things that have crossed my path in the last 2 years, but a woman at Sacred Heart, so in the palliative care service, so she's dying. She had tried to commit suicide herself. She had a motor neurone disease, and she had taken medication. So this was some months before. She had been admitted to Prince of Wales Hospital. So someone got her there in time. She was resuscitated and she was still alive, and she hated every single minute of it. So she was coming to the point of being so weak that she could not even put pills in her mouth anymore. Her hand, she couldn't grasp anything. So, she again asked her family to help her take her life. And we just had an amazing conversation at our place because she came to St Vincent's, or to what we call Sacred Heart in the palliative care ward. And I met her. I said, I'm not going to sit here and talk about a person, without meeting her. It wasn't about a decision we were making. We were going to help her and support her, offer her food if she wanted food, etc., and feed her if that's what she wanted. But if people refuse food, you can't actually force feed them. And if people refuse to have what they call the tube into their stomach, you can't do that either. And if the family don't give support. So basically, electively, she stopped eating. And, we had the big debate, are we euthanizing, are we not? And we weren't. We weren't. There was no active intervention. We offered her food, we offered her drink. And her husband, if you sat with her and her husband, he brought in beautiful Chinese, she was Asian descent, Chinese tea, and he brought her in tea and she would have a teaspoon at a time. So, you know, amazing stories, but she was ready to go. So she was healing on her way out. I don't know where to stop. I'll quickly go through. Okay, I'll stop with the learning. There's the transformative journey. It's one of our favourites. We love learning. He's on the journey. I had so much more to share about the tradition, but I think with reading and some of what you've heard from others, I think that's probably enough. But I wanted to finish with a prayer. Would you mind, Phil, sharing this out? It's called The Path of the Healer. The reason I chose it, because it's a prayer written by the Central American Indians, and it's about American persons leading us through it, but it's based on this Central American Indigenous prayer. When James was talking about cultures, I think the shaman sense of healing, our traditional cultures, and they all had beliefs around healing as well, and diseases and curing. But there were shamans. There were always people that we went to for healing, and we had an Aboriginal person at work, and if I talk to her about, you know, things that are happening, like her dad's got a lung cancer at the moment, but they say in their community they have a spiritual healer, and it's not about curing the disease, it's about supporting them. So the local Aboriginal group, every community, she said, and I learning this, I didn't realise that they would have had someone identified as the spiritual healer, and that would be to support them emotionally and psychologically. Now it's just going to take me a little while if you could read through it, because then I'd like to invite you to close your eyes as I play this, because there's an American woman who reads this, and you know it? I've said it before. So you have a read so you become familiar with it, and then what I'd like to do is just offer you the opportunity to hear it.
Sorry, Julie, the two Adelaide people have a flight.
Oh, you've got a flight, off you go. Fly away.
So,
thank you.
Stuart and Carla, thank you.
So I didn't know that, so bye-bye.
Sorry to interrupt the moment.
No.
So,
I didn't know. I thought there was something, but I wasn't sure. So, okay, safe travels.
See you both.
It is directed at medical professionals, but in a way we are all physicians. Mm-hmm. So when you're ready, just with all that you've shared today before this session, and all that you bring to this session, and wherever your own heart is at the moment, just invite you to listen.
Every individual who carries a call to healing is a person who carries a great heart and generosity of spirit. So how do I, as a healer or a healthcare professional, renew myself? What sustains me? What regenerates me? What heals me? You may think of yourself as a doctor, nurse, health professional, and yet in many traditional societies, you would be called a medicine person, a shaman. You would be called a shaman because you have the privilege to steward the mysteries. And one of the mysteries is illness, which is an initiation to coming home again, to a deeper sense of self and well-being. The greatest healing force on the planet is love, and all the arms of love: gratitude, acknowledgement, appreciation, forgiveness, laughter, play. Which of these do I bring when I'm asked for help? Where can I trust implicitly the healing presence that I bring? I'm reminded of an old healing prayer. Do all the good that you can, in all the ways that you can, by all the means that you can, to all the people that you can, in all the places that you can, for as long as ever you can. Healing does not take place in the fast lane, nor does it take place as only stewarding the technical. For anyone who is called to the medical profession or the healing arts, the true calling is to access the deeper healing gifts that we carry within. So my hope and wish is that you do all the good that you can, in all the ways that you can, for as long as ever you can.
So thank you. Who's back? More words.
So just on your behalf, thank you, Julie. I think we all sense that if the spirituality of the heart is not about healing, then it really doesn't deserve the name. So thank you for breaking it open a bit for us and helping us to touch into our own experience and our own deep felt need of healing. that makes us members of the human race. And please accept from us a small token of thanks.